everybody, my name is Nolan Winkleman. I'm a licensed PT in the state of New York, and this is going to be video one for the channel. So the main goal with this channel is really help you guys overcome kind of pains you're having, whether you're really active with lifting or just having random pains, you're sitting on the couch all day. This is going to help you. So the topic of the video today is going to be medial epicondylitis, which is pain in this region of the elbow. Keep in mind with all of this, I am a physical therapist, but I'm not your physical therapist. So it's going to be good for you if you try these exercises, you notice they're not working. I highly recommend you go into a physical therapy clinic, you go to your doctor, you get the issue figured out. But these are some exercises you can try in the meantime to see if they benefit you. So I know we're all busy people, so I'm going to put in timestamps for you. But obviously, if you want to watch the whole video, great. If you just want to skip around, that's fine too. I won't be offended. maybe a little bit offended, but for the most part, not too offended. So first, we're going to go into the anatomy of tennis elbow. So the main muscles involved are going to be typically your pronator teres, which is the muscle that does this action at the wrist, your flexor carpi radialis, which does flexion at the wrist, and also some of this movement, flexor carpi ulnaris, and then the flexor digitorum superficialis.
Here's a picture of the anterior forearm muscles, as these are the most commonly affected with golfer's elbow. So current research is showing that medial epicondylitis might not be the best name for this condition because itis implies inflammation. And typically with this now, you're not seeing a whole lot of inflammation. Typically, it's more of a degenerative change in the tendon.
So the big thing right now is that with tennis elbow, which is on the opposite side of the elbow, the focus now is on scapular strengthening because there's a big correlation between scapular weakness and that pain on the outside of the elbow. There's not as much research on the inside of the elbow, but there's a couple of things that I was able to find online, and through my practice, I've seen work with people showing that medial epicondylitis also has a link to that weakness of the scapular muscles. So you'll kind of see that in our treatment section. We're going to be including things specifically for scapular strength in there. This injury is really common in kind of golfers, which makes sense. It's golfer's elbow. Tennis, it's common in baseball. It's common in weightlifting, kind of all those active things, but it's also really common in jobs such as carpentry, plumbing, construction, where you're using the muscles of the forearm a lot. Typically, this is going to be an overuse injury, so meaning you're not letting the muscle recover, you're repetitively straining it, and then it's going to build up over time. But it can also be due to a traumatic incident or like a one-time event. So for example, say you do a muscle up. When you go up, you flip over, you get that elbow pain. That can also be a very acute thing, but typically it's going to be due to repetitive stuff. So risk factors for getting this. So it's really common in athletes with kind of training errors. So if you're not working on kind of load management, say you're in the gym all the time, just constantly going, you're not giving the tendon any time to recover, you're not taking deloads, you're not modulating your volume, changing your volume, all that kind of stuff, that can contribute to it. It can also be due to poor form on exercises. Other risk factors are like decreased strength in the wrist flexors, decreased flexibility at the wrist and elbow, decreased endurance of the musculature. And other ones can be kind of like work-related stuff, so excessive physical work. If you're just doing really repetitive stuff, you keep doing it. Another very common related cause of some of that medial elbow pain, a lot of times there will be cervicalgia, which is neck-related pain or more of a neck-related issue that is then referring down the chain into that elbow. So I'm going to include some stuff for you guys to work on that. With that said, let's get into the fun stuff, the exercise portion.
So here you'll see me doing a cat-cow for upper back mobility. When you do this at home, I want you to go slower and kind of hold it at the top. I was just going a little quicker to get the video in so I could get back to my workout. This next clip is also working on upper back mobility, so you'll see the side view, and then you'll see the view from the front. You can kind of notice that I'm going as far as possible, but I'm also sitting back on my heels to make sure it's an upper back exercise and not lower back. Here we have another option in place of the cat-cow, so you can see I'm extending. Key thing to focus on this is to squeeze the stomach so that you're getting upper back mobility and not just rib mobility. I typically advise my patients to not go above a 4 out of 10 pain in the elbow when they're participating in their activities. So one way you can kind of modify activity to lower the amount of pain is using lifting straps. So here you'll see me using lifting straps for these stiff leg deadlifts. So you can use those while we strengthen the musculature and get your symptoms down so that you can continue doing your exercises, but modify them a little bit. Another temporary activity modification is doing hammer curls instead of normal curls because they put a lot less stress on the muscles commonly affected and utilize more of the brachialis. So the next exercise is going to be an isometric for wrist flexion. Isometrics help a ton for pain relief, so that's going to be good early on to incorporate. Next, you'll see me move into an eccentric rep for wrist flexion, so I'll lower with one hand, raise it up with my other hand. The next stage is going to be moving into concentric, so you're doing the whole motion, concentric and the eccentric portion. Next, we move into a bit of a pronation exercise. This would be great to do with a band as well if you can set one up just to get the line of resistance a little bit better. So those are going to be two of the muscles that are mainly affected. A third muscle also often affected is going to be the flexor digitorum superficialis. So for this, we're getting some wrist and finger flexion into the movement. So moving further up the chain, one important thing to address is scapular/shoulder strength. So here you'll see me doing this with a chest expander. You can do it with a resistance band, just get like a green or blue band. Here I'm doing some rotator cuff side lying. With this one, I would say put a towel under the elbow. Research-wise, that's what's shown to activate more rotator cuff. I'm doing it with lightweight, baby, with that water bottle, mostly just because I don't have a dumbbell at home right now and I wanted to finish making this video. But if you have a dumbbell or you're at the gym, grab a lighter-ish weight, knock out 15 to 20 reps of that. I just want to take a second to say thank you to everyone for watching this. If you found it helpful at all, please like and subscribe. Or don't, kind of do whatever you want to do, but I would appreciate the subscribe. And yeah, check in on future videos.